Good afternoon, everyone. Welcome to our Meet Me on the 7th in honor of our 7th anniversary. I'm happy to be on live with you today. We'll give folks a few minutes to come in and get started. This is Kelly Garrity, the Executive Director of the Jennifer Bush-Lawson Foundation. Hard to believe, but I have finished my first year as Executive Director. I feel like 2020 just flew by, and I personally can't wait to get to know more of you and see more of you this year as things really start to, open up and we resume, quote unquote, back to normal. So I can't wait to have that happen. We decided to do this Meet Me on the 7th series because I know so many of you get logged down in email, and we send a lot out, especially in the last part of the year. So I wanted to give everyone just a quick moment to be able to have some updates on our work, to be able to see updates on our work that's not in your email inbox, that's not on social. And really give you guys a chance to get to know the nitty-gritty of JBLF outside of just our yearly 5K, where, I can't wait to see everyone in the fall, which I'm excited about. I wanted to take time today to just go over some of our grant making activities. We have a very strong partnership with the Virginia Hospital Center Outpatient Clinic, and from our very inception, from our very first 5K, have done quite a bit with them for funding programs that may not have otherwise gotten funding. One of the first things that we did with the Virginia Hospital Center Outpatient Clinic was to help their pediatric center by funding 240 infant appointments for their first year of life. So many of you have kids, so you know that in the first year, infants have upwards of 8 appointments that they're going to have to go to for their vaccinations, for seeing the doctor. Most infants get sick in that first year, so we were happy with that first year after our 5K to help the pediatric center in funding 240 infant appointments for their first year of life. We were able to follow that up with a grant that went through 2 years, actually, 2017 and 2018, with the Virginia Hospital Center to help get their telemedicine program off the ground. They had received a grant through one of the insurance companies, but it did not cover staff time. So we went through a process with them to identify what their need was, and we were actually able to help fund all of the staff time for that telemedicine program for 2 years. That program was innovative when it came out in 2017. I know so many of us are so used to telemedicine at this point after last year, but back when it started, it was groundbreaking, especially with low-income moms. The low-income moms that were part of the telemedicine program that Jennifer Bush-Lawson Foundation helped to fund actually were able to access their care from their place of employment. I know from talking with the clinic, many moms took appointments from their car. They took appointments from the closet of the place that they were employed, or they were able to not have to worry about daycare and take an appointment from their house. The telemedicine program that we were able to help provide funds for, that so many of you as 5K participants and as donors to the Jennifer Bush-Lawson Foundation helped fund, made a difference in these women's lives. The clinic actually saw a reduction in the number of C-sections, the number of ER visits, the number of NICU stays for the babies, which NICU stays are a drain on the family, let alone the baby and the mom. And we were so happy to hear that in 2020, the hospital itself actually pulled the telemedicine program into their budget and wrapped it all into what they were willing to fund. I'm excited to announce that last year in 2020, we actually helped to fund a new program at the clinic called the OB Connect program. It builds on the work of the telemedicine program in ensuring that low-income moms get access to care that they need in a way that meets their lifestyle. One of the biggest things I love about the OB Connect program that we help to fund is that all of the moms in the program have one main point of contact, which is an OB Connect nurse that they can call or text or message if they have any issues. That person is their continuity across all of their access to care in the OB Connect program. I think what's important about that is when these moms, much like anyone who's gone through a pregnancy in a bigger office, come in for their OB care, they might see upwards of 5 doctors, several nurses, residents, students. There's certainly a lot of faces that they're going to see as they go through their pregnancy and their OB care. What I love about the OB Connect program is no matter what doctor or what provider they're seeing, they still have that one nurse who's going to be the go-to person that will check in on them, that will make sure that they understand what they need to do from their appointment. That nurse also is able to provide telemedicine access in between their appointments, which is key for these times that we're living in now. I'm excited to say that the first OB Connect baby has already been born. It was born last month from a mom who entered the program in the last half of her pregnancy. And one of the impactful things we've already seen from that is this mom was having mental health issues postpartum and really struggling to feel like she was doing right by her baby. And the OB Connect nurse was actually able to get her connected with support groups that helped her feel like she was doing right by her baby, that she was a good mom, that she was going to be able to do this. And without that person that she felt comfortable reaching out to, I don't think that that help would have been gotten. That's just one of the things we're seeing out of this OB Connect program. I think it will extend into the greater hospital environment. It's one thing, as we saw with the telemedicine program, that the hospital has a vested interest in making sure that they are working with everyone that comes through their doors. We, of course, focus on the low-income families, but they are really interested in making sure that their entire community is taken care of. I am looking forward to seeing more people, hopefully, on these lives as we go through and get into more of a routine. I wanted to just say that a few things coming down the pike you guys might want to watch out for is we are starting to plan for our annual 5K. It is going to be a little bit more like normal, which will be exciting. We are hoping to have the Family Fun Day. We're exploring ways to keep it safe and opportunities to introduce some new games and things that we may not have had before. We're also exploring ways to have a lower touch 5K option for those people who aren't necessarily ready for a mass start or a big event. I know after the past year, many of us being in crowds still get anxious. I know I certainly have. So we are exploring that. We are bringing our blog back, so you'll start to see not only some get to know you posts. If you missed the most recent one, it was on our board member Colleen Borelli, and one of the things that I found most interesting is that she does not like ketchup. Fun fact about me, ketchup was the only way my parents got me to eat vegetables and new foods as a kid, so not liking ketchup certainly struck me. We have an intern that is with us this summer that you'll get to know, as well as our other board members and longtime volunteers. Not only will you get a chance to know some of the staff and volunteers with the JBLF, but there's some topics that we wanted to bring to light for our community. a lot of information around access to care in the first trimester. For example, in Arlington, only 1 in 3 pregnancies actually has access to care or gets access to care in the first trimester. We are diving deep on that in the blog that we're bringing back. Another interesting thing is that there's been a recent expansion of the Medicaid program that these families are able to access. And it importantly will start to cover the first year postpartum for these moms and for anyone who's in the program. That has the opportunity to be transformative for that postpartum period where we see a lot of risk in the moms and babies' lives. We're going to cover some other meaty topics like that, and I hope you're on the lookout for that blog as it comes back. I do want to cut today and say thank you for those who've joined in, and thank you for those who are supporting us. I don't want to take too much time. The goal will be to have these monthly lives be only 10 to 15 minutes long, cover some things that we've been up to or are looking forward to. I also hope if you guys have anything you want to know about our work or what we've done, shoot us an email, send us a message, and I'll be happy to cover that in our upcoming live feeds. We'll also hopefully have some of our board members or volunteers on as well, so that you're not just seeing my face. Thanks everyone who tuned in. I look forward to the next one. Bye now.